For more on this topic, I spoke to Dr. William Schaffner, a professor and chair of preventive medicine at Vanderbilt University Medical Center. And I asked him what we can do to prevent contracting the superbug.
The important thing, Elaine, is for us to be careful and only take antibiotics only when they're needed, of course. There are lots of people who get upper respiratory infections, that is, simple little colds and such, and who go to their doctors actually expecting to be treated with antibiotics. And most of those infections are simple viral infections that will get better all by themselves, and antibiotics don't help them at all. So we ought not to have the high expectation of antibiotic use. And then, of course, the other thing we can do is be hygienic. Wash our hands frequently.
What is your biggest concern with these so-called superbugs? Let's talk worst case scenario here. Could we get to the point where we see mass plagues and deaths as we did centuries ago?
Well, let's not quite panic yet, but infectious diseases doctors are genuinely concerned that we could have new superbugs, bacteria that are multiply resistant to antibiotics, such that we don't really have a licensed antibiotic effective against that infection. And we're already talking about the post-antibiotic era. You know, we talked about the pre-antibiotic era, you've mentioned that. Now we have antibiotics that actually work against these infections, but we could be at a place pretty soon where there are infections that we are unable to treat or treat only with great difficulty and a combination of antibiotics.
Well, what's the answer here? You mentioned that, but is it developing new and different kinds of drugs? What's the pharmaceutical industry doing about this?
Yeah, well, there are a number of answers. One is that we as clinicians have to be careful. The public health system has to be on the alert, so when they occur, we institute things so that the bugs don't spread. And also, we need to actually help the pharmaceutical industry, because antibiotics are very expensive to develop, but they don't bring in the return to the company, the financial return that other drugs do. Because if you take a drug against high blood pressure, the patient will take that drug for the rest of their life, basically. Whereas antibiotics, well, we use them for 7 or 10 days. So from the point of view of the investment of the company, it's much less effective.